Senator Smith, thank you for that kind introduction, for all of your work and leadership in this area. I know it's coming from the heart. VA, the Veterans Administration, has been an active partner with DOD, with HHS, the Surgeon General, and the National Action Alliance in developing the national strategy for suicide prevention. Over the past 4 years, we at VA have been grateful for the President's strong and decisive leadership for veterans and service members, and particularly for his support to improve mental health and reduce suicides. We're fortunate to have over 20,000 mental health professionals working at VA. Our budget has grown by over 40% in the last 4 years, and we believe that we are providing innovative and leading-edge care in more than 900 locations across the United States. Last week, President Obama issued his historic executive order to further improve mental health services for veterans, service members, and their military families. It includes a hiring initiative of an additional 1,600 mental health professionals, a 50% increase in the individuals who man the crisis line 7x24, and a new outreach campaign called Stand By Them. Our efforts at VA center on expanding access to high-quality mental health care and building on our historic partnership with the Department of Defense to combat suicide among service members and veterans. And we know that VA care and the crisis line work. Our system of care is the best in the country. Since its inception, one element of that care system, called the Veterans Crisis Line, has received more than 655,000 calls. We've made over 93,000 referrals for care, and we have rescued nearly 23,000 callers from potential suicide. History shows that the costs of war are going to continue to rise in the coming decade, increasing the need to provide more mental health care that our veterans have earned and that they clearly deserve. And we've learned through that experience that we still miss many opportunities to prevent suicide if only we had had someone into care earlier in the process. Time and again, after a suicide, family members, co-workers, friends knew that something wasn't right, or that a veteran was having difficulties, but they didn't recognize the warning signs, or they didn't act on them, or they were unable to convince that individual to seek help. Now, let me give you an example of when this process works right. Recently, the Veterans Crisis Line got a call from a veteran's mother who was several states away from her son, and she just knew something was wrong. Call it a mother's intuition. He was a post-9/11 veteran who had difficulty adjusting to civilian life. She couldn't reach him. She had reached out to his girlfriend. They had recently broken up. She had received an email that worried her that he was considering killing himself. She wanted to travel. The judgment was, look, if I get in a car now, too many hours, I won't get there in time. So she did something that we want you to consider doing here today. She picked up the phone, called the Veterans Crisis Line as a family member and said, my son needs help. And that group of expertly trained individuals used their network to get an individual at that individual front door in a matter of hours. He was intoxicated. He was considering taking care of his life. Today, he's alive. He's engaged in care at the VA, and he's involved with our Iraq-Afghanistan coordinator at his VA Medical Center. We need to help people recognize that something is wrong and know what to do with that insight. There are thousands of success stories like this, made possible by the Veterans Crisis Line and the VA system of care, but we certainly have much work to do. What we've learned is that it's going to take all of us. It's going to take folks at VA, at DOD, the community health providers, the family members, the friends, the employees and the co-workers, the neighbors, the faith-based organizations, and veteran peers to make a difference for service members and veterans transitioning back into their communities. And you can help. Recognizing the warning signs that someone is having trouble and knowing where to turn to help will save lives. Today, VA is releasing a new public service announcement called Side by Side, and it's focused on that important role that family, friends, and community play in supporting veterans who may be in crisis. So let's take a moment together to take a look at that video.
We used to get together every week. She's been home from her last deployment for months now, and I haven't seen her once.
He's just been different since he got back from Iraq. One minute he's ready to go, and the next he doesn't want anyone around.
The nightmares are back and seem to be getting worse. Shouldn't he be sleeping better after all these years?
A lot of people don't understand what veterans go through during their service or when they come back. And that's okay.
But everyone can help.
You can make a difference in the life of a veteran.
You stood by us when we were in uniform. So stand by us now.
Like my brother did. And he wouldn't take no for an answer.
Like my wife did when she asked the right questions.
Like my friend did when she made the call.
Stand by them. They stood by you. Visit veteranscrisisline.net.
So there you go. The VA is here to help veterans, families, and friends reach out to our loved ones, the people that we love and treasure. And we're urging everyone here today, community-based organizations, veteran service organizations, healthcare providers, private companies, and other government agencies to connect veterans to our Veterans Crisis Line. Here are the numbers, and I thought I'd never live to see a day where I'd look into a TV camera and say, you need to call this telephone number if you see or know someone that's in crisis, 1-800-273-8255, and press 1. Or you can join us through online chat at veteranscrisisline.net, all one word, or by text message at 838-255. Working together, leveraging our resources, we can stand side by side to stop suicides. It's a matter of hope. It's a matter of care and of community action. It is a privilege for VA to be a part of this National Alliance to Combat Suicide in America, and it is now my great honor to introduce the Secretary of the Army, John McHugh, a true friend of our service members and veterans, and the Public Sector Co-Chair of the aptly named Action Alliance.
Thank you.